people, and welcome to Ask the Experts, where you ask the questions and we get an expert to answer your questions. And today we have a clinical psychologist in the house. Yeah, a lot of mental health issues going around, and we're narrowing it down to anxiety. Yeah, I know most of these terms have for long not been seen as mental health issues. But apparently anxiety can be a mental health issue. Actually, there is anxiety disorder, but let me not get into the details because what do I know? So we have Dr. Stella, a clinical psychologist on set, and she will introduce herself further. Dr. Stella, tafadhali.
Thank you so much. Thank you, Anne. Thank you for this day. This is Dr. Kerongo Stella. I'm here today to talk about anxiety, but before I talk about it, I'm a clinical psychologist. I've done a BA in pure psychology. I've had a master's in counseling psychology and a PhD in clinical psychology from Daystar University. I've an experience of counseling for 10 years. And I've dealt with many cases of anxiety, trauma, depression, issues about family, couple therapy. I deal with children, adolescents, and I also deal with special team, more especially the deaf. And my dissertation was about the deaf and how they can manage their depression and yes, perform and just be like the other learners.
Thank you and karibu sana, Dr. Stella.
Thank you.
Her story about how she ended up dealing with the deaf is also another one, because now she's also a sign language interpreter, very interestingly. But we can really talk about much more of that. But today it's about anxiety, and your questions about anxiety, which Dr. Stella will answer, are, first of all, at what point is it necessary to see a doctor? Is what I have just anxiety, or is it a disorder? I'm imagining this somebody who understands the basic meaning of anxiety, as being nervous and stuff. But at what point do I know that this could actually be a problem that needs to see a doctor?
Thank you, and once again, we have anxiety disorder. And so there are many disorders which are in mental illness. We have depression, we have bipolar, but not many people know the difference. Sorry, I might use a sign language and then disrupt, but I'm sorry about that. So we are narrowing down to anxiety. And what is anxiety is the way it becomes a disorder when it makes you not to be able to perform your functions, when it affects your daily duties. That is when it becomes you need to seek help. But we have anxiety which makes you also to, like when a student is doing an exam.
Exactly.
Yes, that is an anxiety, but even when you are going for an interview today,
yes,
you have some anxiety, which
like
is normal. Yes. Like when I was coming here, I was asking, yes, what is it about? What is about the interview? I was dealing with my anxiety, looking forward to something, even an employment. It brings some anxiety. But that is anxiety which is manageable, which is positive in a way. It makes you also think around and see things in a different way. But we have anxiety which brings some ailment in our body, in our way of thinking, in our way of functioning. And this is the anxiety you find, like somebody standing doing a presentation and then he's sweating all over. His heartbeat is so high, you can see it actually. Palpitations just even outside, somebody from far can be able to see. And then he cannot even be able to give a speech. And then he goes down, he's just sweating, he's trembling, he's not able to talk. And then it goes down to he's shaking and he cannot be able to stand. So you find that is affecting. If it is about work, you cannot be able to work. You cannot be able to deliver. For a mother maybe who's having a child, you cannot be able to hold that child. So that is the anxiety now which needs attention. And we have that one, it needs attention, and it has to be repeatedly for the 6 months. If it is an episode which is for the last 6 months, then it needs attention and urgent attention, because it goes down and it affects some vital organs in our bodies.
Oh, really?
Yes, yes. So there is need when you feel like you cannot be able to stand, you cannot be able to go to work, you are just there, you cannot be able to eat, then you need to see somebody to be able to help you.
Is this, does it have to be continuous? Do these symptoms have to be continuous? Or even if I observe that there is a trigger, like when I'm afraid about something or when I think about a certain things, these things happen. Can it just be that way? Whenever I'm triggered, this happens. Whenever I'm triggered, this happens.
Yeah, the trigger is just a trigger, but sometimes they happen. You feel like we have different ones, and we have those ones when you don't want to talk in the public. We have those ones when generalized, you cannot be able to pick. Generalized anxiety, you cannot be able to pick why are you becoming anxious. You cannot be able to find out why. We have panic attacks. Panic attacks can be able to just come into you even when you are walking. So the triggers which are there, like it is the trauma. When you see something which is related, then you go down, you go. We also have issues which we had from our childhood. You find like a child who was had some trauma when he was young. So as he's growing up, the environment, the way he's interacting with the environment, the things which are like bang like this, just or seeing an accident like this, or seeing some people fighting, he becomes so anxious because of the undealt issues which he went through in his childhood. We also have, I was like, now we are in this room and then we are attacked. Anytime you feel like you are in a room like this and lights are there, they trigger you and you get that anxiety. Yeah. So, but when the pattern now, it is repeatedly, it affects your functioning, it affects your way of thinking, and that is when somebody needs help. If it is not dealt with, it graduates now to a disorder. Yes.
Okay. So your question number 2 was, who really should I see? A therapist, a psychologist, a doctor, a counselor? Apparently, I don't know the difference. Who is who? And when I feel like these symptoms, hey, this is really anxiety that needs which doctor should I see? Yeah.
It is very advisable to see a therapist. A therapist, a counselor, those are the same people. You can see a therapist. A therapist will help you identify what is causing you to have anxiety. He'll be able to identify how far it has gone. We have assessments we do and see, is it how severe is the anxiety? How far is it? So we have some criteria to meet that the anxiety, the major anxiety, how can it be dealt with? And we have that one which has gone to an extreme. Then we bring in the doctor. So you find like a clinician, a therapist is working hand in hand with a psychiatric to be able to help the clients. But that is when it is, the first thing first is to know the symptoms of anxiety, to know if you see like you're not eating well, you're not sleeping well, you are having these panic attacks, and it is affecting your thinking, your daily functioning, your work, then you need to see a therapist, a counselor. Those are the same people who can be able to help you, to calm you down, to identify what is causing the anxiety. Yeah.
So if this has not been identified by a doctor per se, it's not because I went to a doctor and they said, oh, you need to see a counselor or a therapist. I should look out for a counselor or a therapist. Wait, what's the difference?
A point of correction, Anne. A point of correction. The first thing is to see a therapist. But you know, because of lack of information outside there,
yes,
you find people taking these clients to a doctor.
Yes.
And then the doctor now refers to a therapist. But it is because of lack of information. But when people know that I need to say I'm having anxiety, the person who should come first, the therapist. Therapist will help you to find out, identify, and calm you down, and give you work hand in hand to find out how can I manage my anxiety, because it is manageable, it is treatable, it can go away. Yeah, it is not something which is cast on stones. It can go away. When it is identified, the root cause, what is causing this? Is it that this person got an accident and the trauma is, he has PTSD and it is now repeatedly coming up and causing anxiety? Or is it undealt issues? Or is it some diagnosis like medications which made this person to have anxiety? Or what is it causing? Is it the conflicts in the family which has caused this? Or is it a loss of a loved one which has caused this?
So if I feel like I'm suffering anxiety, I can, Dr. Stella, for example, is on social media. So I believe, like, I can DM you.
Yes, you can.
And tell you, this is how I'm feeling.
Oh,
you
yes.
You don't need to refer me to a doctor.
No. We have to work with you first. Find out what is causing you that anxiety. And remember, we can handle this without seeing a doctor. Yes. And for those people who were brought up in a very good attachment, they can be able to manage it even alone without seeing a therapist. Okay. But they need somebody. They need they have to, you see, that is why it is important to do a self-evaluation. And when you do an evaluation like that, you can be able to know your strengths. I can manage this. And also it depends on what you put in yourself, in your brain, in your cognitions, what you tell yourself. Because like somebody suffering from agoraphobia and anxiety, you find like he's telling himself, oh, when I go to present this, I'll be able to start sweating. He's already seeing the sweating. He's seeing the trembling before even he has started. Yes.
Wow.
Yeah.
Great. What are your social media handles at this point when we're talking about people finding therapists?
Stella Kerongo. That is in IG, in Twitter, and in Facebook.
Okay.
Yes.
Stella
Kerongo. Yes.
Okay. Beautiful. So our last question, which Dr. Stella almost answered, is can I just let it go away on its own without having to see a professional? What if I really don't see a professional? What if I don't go to a therapist? What might happen?
Thank you, Anne. That depends on many variables. One of them being your personality. Second, how you were raised. In which environment are you? What do you tell yourself? Because what you tell yourself affects the way you feel, the way you think affects the way you feel, and it affects your behavior. So if you think like, hey, I'm that weak person, I have this anxiety, I can panic when I go in front, it affects your feelings. And when you go in front, it affects the way you behave. You start now trembling. The way you were brought up, the attachment you had, the attunement you had with your parents, the values which you were brought with, it will also help. Tell me somebody who was maybe brought up in a church with very firm values is able to manage life very well. If a child was brought up in a conflicted family, in a conflicted family where there were wars and their parents were not present. There was no that attachment. And then this child navigating life outside there, peer pressure, is very easily to sway. And so when he's faced with any or exposed with any challenge, it's not easy to cope. Adopting is not easy. It takes time. And so when you have this anxiety, let's say you got in an accident, going back to where you were, you're always remembering, but you can be able to work the way you tell yourself. You can be able to unwind and tell yourself, it is gone, this is now I move on to another level.
But I need a lot of knowledge.
You need a lot of knowledge.
Level of ignorance that the common folk we have, me inclusive, because most of these things we are not very fully aware of them.
Yes.
We first of all are not able to acknowledge that we are suffering anxiety. We want to imagine it's you know, ni woga tu, ni katrauma tu, you know.
Yes, yes.
I imagine that we will need to be very knowledgeable to imagine that in case that I actually suffer anxiety, I will deal with it, because I need first of all to know that I'm suffering this.
Yes, yes. You need first to accept that you have a problem. Another thing, Anne, you need to have very good self-awareness. Know who you are. This is my strength. I know I can carry it on. I know I can be able to move. But when you are coming from that weaker point, and which is very negative, and which is, I can't be able to do it, I can't be able to, so negated, it is not easy to manage it. Because now you are very vulnerable. You're already vulnerable. But when you pick it and say that, yes, I can be able to do it, and also feel the very positive things in your brain, in your cognitions, be very positive. And the positivity, remember, Anne, it triggers back to the way you feel and back to the behavior. So the what you tell yourself. But if you are very vulnerable, it becomes so difficult. If you are vulnerable, it becomes difficult. Maybe you can call me another day. We talk about personality too, because it is a prod. Personality also, different personalities make people to handle things differently, very differently. Yes. Yeah.
Thank you so much. I believe that was very, very helpful. Keep sending in your questions whenever we ask them, because whenever we ask these questions, because we're bringing an expert in. So keep sending in your question. Comment down here, because we might as well just call Dr. Stella again to clarify on some other issues, because these are things that really, really need to be addressed. Dr. Stella was telling me, especially now, COVID, is it even post-COVID? I don't know if it will ever be post-COVID, but since COVID, these mental health issues have really, it's like they've exploded, right?
Yes.
And that's why we're even becoming more aware that they exist. So yeah, you can find Dr. Stella if you need her counsel on anything, if you need to hear her word on anything, if you're not sure what you're going through, you can find her. Stella
Kerongo,
right?
Yes.
Yeah. Thanks for watching. See you next time.
Thank you.